play with it some more, I want to add certain things, I can. But if it's a case where I set everything up in Roulette the way I want it, have all my pressure points, and I just need the trays made so I can print them, that's been probably one of my favorite things that has put us to the point where we can create these, and somebody comes in the morning for a consultation, if it's a simple movement, it's a relapse, something like that, I can have them ready by the afternoon. Now, why would I ever need to do same-day aligners? Sometimes that's my question. I hear that in the marketplace a lot, like same-day aligners, same-day aligners. Why in the world would you ever need a same-day aligner? Well, I'm in God's waiting room, down in Clearwater, Florida. I have two people. One, people that go to Canada or North Carolina for 6 months, and two, college students that are visiting their family on their way home. The most common time I use same-day aligners is when the college student comes in, it's Monday of Thanksgiving week, or it's August 10th, and they have to go back to school in 3 days. Traditionally, if I use another aligner company, any other type of aligner company, and I have to wait for that product to ship, I don't have a patient. And so the ability to use the US software, create the case, deliver it that afternoon or the next morning, those are the #1 reasons why I definitely love using the same-day aligner technology. So that's a major example. Sometimes I have patients that come in and they're going to Canada for 6 months and they're leaving in a week. They went to see their dentist before, they have a traumatic occlusion, or they have some alignment they want to get done. I use dental monitoring, and the dental monitoring platform allows me to monitor that patient, allows me to grab STLs if that patient needs a refinement while they're out of town. I bring it into the office and I make it work. Now, can any printer do that? You know, we talked about that earlier, Kevin. Can any printer do that? Any printer can, but no printer that I've seen can have a tray that fits the tooth. So a tray that actually fits the tooth is a lot smarter. To me, that's the decision. Having that engagement, and as we're doing some projects on, a reduction in attachments. So those are some of the big pieces that I'm working on in the office right now. Once it generates, essentially you bring STLs in the PTSN trim file, you hit generate, it creates all the LNX files or all of the alignment-based files for you in that situation. You can see here, I just transfer it, it goes straight into LuxCreo. I mean, I just can't emphasize enough how much easier it is instead of bringing the files in, going through, having to look at each one, even one click. One click was great and I loved it and I think it's awesome, but this fast track is an absolute, makes this process so much easier and makes this product, I think, exponentially better for an end user like me. That's the important part when I look at this LuxCreo. That is a game changer for me versus anything else that's out there. Now, of course, I've been using it for 18 months, and you can also say I've seen the iterations go from where it was to where it is now. And just like Sonny was saying, I can't imagine what it's going to look like a year from now. I just hope I'm blessed enough to be involved in it. I mean, it's just amazing what they're able to do and how they're able to do it. With a beautiful facility like this. This is my first time at this facility for this grand opening, and to realize what they're able to create in this space. Once again, I'm kind of fanning out. I'm kind of fanboying, so I apologize. I hope that's okay, but I just feel like I'm geeking out a little bit. But it's just so amazing. You know, the one thing that we're working on right now is, and I think Raj, I think you guys have something for that now already. Because what I was showing here is how I go in and how it takes no time to put a little bit more clearer label of the number of the tray on the case. And I believe now that's even taken care of. Now it's 20 seconds, but it's even better to have it now.
Beta on Monday.
That's always the case. I ask him a question, he's like, yeah, the beta's coming out Monday. That is a conversation we have quite a bit. I'm like, hey Raj, what about this? He goes, yeah, it'll be out next Tuesday. Excellent. I love that. 13 minutes to have these vertical prints done. At 70 degree support, at 45, it's a little bit less. So those are two indications to look at. Something else as an end user that I see is that I never do these overnight, personally. Because of the the way the wells are, because the way the resin can sit inside the tray, we typically will always process them and get them off the printer and into the alcohol before we leave. So I try not to leave these overnight, or really in about 20 minutes, we want to be able to get them off the printer and put them on there. So that's, as an end user, that's something that we use as our consideration. It's really not that big a deal, because a lot of times we're still making models for other things that we're doing, so those will print overnight. And on the LuxCreo, I can print 12, 15, depending on the size of the models. So, and splints, even splints with different support structures, I can print those overnight because of the rigidity. It works really well. You know, the IPA bath, you know, the 2-tank system. You know, some of this, most people in this room have done this quite a bit, so I don't want to worry you washing it. We got that. This is a different step. This is a little bit older video. Now we've got the, can I say it?
Lux Oven Pro.
The what?
Lux Oven Pro.
Lux Oven Pro with a handle. So yeah. My team always jokes. I mean, come on, we can joke about it a little bit. You know, my team always says, "Hey Doc, can I make fries in that?" Just don't put any salmon in it or something. We have a son in college. He's a senior at Tulane. He loves his air fryer. My gosh. He came home one time. He showed us how to put salmon in it. But he's in New Orleans at Tulane, so when he got home, he took my wife to the store because we didn't have enough spices for him. So now he's Cajun or something. I don't know.
Food is not an RSOP. and then the other thing is that if
Don't
you have,
put food in it.
If you have the dehydrator, all you do is just buy one more bottle of ECA resin, and we get the new Hilux Oven Pro for free. Okay.
Good. And then the cure box. Once again, and, you know, for those that have printed for a long time, or for at any time really, you know there needs to be a cure box. And then, there you go, you just pop it off. 2 things I love about this. One, I love tremendously, is because when we would do thermoform trays in the lab tech would have to cut them out, we make them wear puncture-proof gloves. They have those thin gloves that if the burr kind of hits their finger, it doesn't do anything to them. So that was a little scary for me, because sometimes I'll go over there and I'm like, where are your gloves? I'm fine, so I'm like, no, you're not. You're fine now. When you nick that hand, now I feel like you're kind of maybe setting me up. So let's make sure we get that right. Just popping these off is easy, and then just a quick polish. So when they polish, I make a massive, massive point about just barely taking, because I work pretty closely to try to get that trim line exactly where I want it. So if they just start barreling down on it and trying to get those little small nubs off, they may mess up my trim line, which a lot of times I'll have pressure points that are close to that trim line that I don't want to mess with. So that's it. That's our process. That's how easy it is to go from scan into ULab, quick export, into the Lux Design software. In Lux Design, generate, and actually now I've added profiles for different blockouts, for different thicknesses that I can do. So essentially they give you in Lux Design and Fast Track the ability to have different profiles. So you're not, like Sunny's example, in the first iPhone, you couldn't add apps, you couldn't move apps, you couldn't do anything. Lux Design has the ability to add profiles so you can customize your different pieces that you would like to do, your different thicknesses, things like that. That was supposed to be the word patient, I apologize. So, simple case, I just kind of want to show some before and after pictures. This individual came in, a couple little crowding, pretty simple, turns out real well, very easy. Proof of concept, teeth move, you wear the plastic. I don't have a bunch of pictures of him wearing the plastic, I just, the teeth move. I don't know how many times to say that. The process is understanding as an orthodontist, is there enough room there? Is there enough bone there? Is the occlusion going to hit? Once I get all that right, the proof of concept is that the teeth moved where they were supposed to. Now, this case, we just talked about this case a second ago. I put this one in here because I thought it was a good example of using ULab and the pressure points on the lingual and on the facial. So the question is, we have a patient that was referred by my periodontist because he really didn't feel comfortable grafting over this area. He didn't feel like the graft would hold real well. And he's like, and I've done this a number of times. Can you take that tooth and just bring it back a little bit? Can you help the patient? We can have a little closer borders right there. And so we use this with the appliance, no attachments whatsoever. We got a small pressure point, smiley face pressure point here, and 2 small pressure points on the back. You kind of saw in the video a little bit where the LuxCreo was able to really get into that. And so that's what I like about the pressure points, is if you thermoform over one of those pressure points, you're gonna have this little parabolic shape. If you print into it, you're not gonna perfectly print that small, because you're gonna get a much better, I've seen a better pinpoint pressure point for that area, so you can define it better. And so you take a case like this and it goes to that. And so at this point, this patient finished about a month ago. The periodontist is actually going to monitor this case, and he feels at her age, she may have some resolution without needing graft. So that to me was exciting, because I know there's some research projects out there. There's a project going on now, I believe, a few of them talking about the effectiveness of aligners on lingual torque or on torque at all. And so for me, this was really exciting to see that a movement that typically can be a little more difficult because it's not as predictable with aligners, with the LuxCreo system was able to create a wonderful opportunity for a young patient. Another patient, a 55-year-old physician that came in, had a couple little vertical issues and had an issue here, a little bit of a strong chin and a little bit of a deep cut. And so using the system, we were able to treat this in about 8 months, where we were able to take out a lower incisor and line the teeth up really nicely. And so it needs a little dental work there, but that's typically my population. Like I said, down in Clearwater, Florida, my average age of my patient is probably 45. And so we see quite a few adult patients. We have a high demand for aligner cases, have a high demand for pre-restorative cases. So having that predictability and lack of attachments, because the less attachments I can use. Now, I'm saying that as a hypothesis. I'm not saying that as something I've proven or have really good data yet, but we're doing projects right now, and we are seeing trends that the attachments themselves, that typically attachments, and I was talking to Mark about back in the late 90s, Invisalign didn't even have attachments at all. And were developed, and they were typically developed, from what I've read, to overcome the fact that thermoform didn't grab the teeth very well. You had no undercuts, you had no grab. So now we're swinging it back, and we're like, wait, if we have a plastic that actually engages the undercuts at the level we define, not what physics allows us to do, that feels like a game changer. And so that's the type of projects we're working on now, is I'm doing some split mouth studies that show teeth that are similarly positioned on either side, one with attachments and one without. And if we can show a similar tracking of both of those sides, then I feel like I have better data to actually say that. But that's an hypothesis at this point, but it does make a little more sense when we look at it. But we are pressure testing that. So we talked about this return. We talked about the number that it takes, the unit economics. And so, yes, your users, your end users, yourself, whatever vertical you are in the dental world right now, at the end of the day, we can buy things, but for us to buy things, people have to buy things from us. And so if we have a predictable solution, if we have a way that we can easily create revenue, my father-in-law owned auto repair shops in the west coast of Florida. And when I first got started, I started a business from scratch. I worked 2 days a week in Tampa, about 45 minutes away, and I just kind of hung the shingle and tried to make it work. And he used to always tell me, he goes, Bill, it's not how much you make, it's how much you keep. He's like, you can meet people that are doing this and that, and this much and that much, but you might be keeping more than them. And so that kind of really stuck in my brain, and I really wanted to understand, I can create all this revenue, but what actually happens? So let's dig into that a little bit. We're going to take about 15, 20 minutes. We're going to go over the economics of direct print aligners. What it takes to make an aligner. What does it take to make an aligner? What are 2 major components that you need to make aligners? Cost. How much does stuff cost? I'm really zooming out here. How much does stuff cost, and how much time is it going to take? Those are the real zoom outs. We're going to get into the nitty gritty of it, but that's kind of the zoom out. It costs you something, and it costs you time, labor and materials, and capital equipment. So bird's eye view on the studies I've done with thermoform. Now, the studies I've done on thermoform, the things I've looked at, are for my office. The goal today is to help you understand the unit pieces to measure. Whatever your labor market is, whatever your, I talked to Ed Lynn about this, his unit economics is different than mine, because he does 1,000 a day or something, whatever the number is, up in Wisconsin. And so the unit economics is going to be different for just about all of us. But the components to calculate that unit economics, that's what I really want to help you understand today. And so these are the pieces that we have to a company. The company makes everything and just sends it to you. Cool. That's buying. You just buy it, it's easy, no brainer. Make has a lot more to do with in-house productions. And as you all probably know, as an end user, we're moving a lot more towards in-house production. I'm actually starting to see direct metal printing, offices bringing that in, laser welding, like a lot of the opportunities to trim, trimming of the models. I'm starting Yote, I believe is a company that actually bending wires for us now. So the whole Sure Smile thing, when I was in school 20 years ago, was revolutionary. I'm pretty close, maybe 1 or 2 AEOs away from just doing that in office. If it's not already there, I don't follow Yote that much, but companies are doing all those types of things. So the ability to have end users buy from companies and buy and have an outsourced solution is never going away, but it's probably going to change a little, and being here with LuxCreo and understanding that this model is evolving and that primary end users, ESOs, OSOs, corporations, they're starting to do a lot more in-house with the technology that's coming around. And so that's the question here, make or buy. I like to make as much as I can. We did a study in seminars on orthodontics, Dr. Kazravi, Dr. Sinner, and myself. We published that last year, I think it was last October, maybe a year ago. And what we attempted to do in that study, if you ever want to see it, is that we wanted to look at the whole concept of make-buy. We wanted the orthodontist to have a roadmap to make a decision on whether they should make or buy. I can go buy a machine for $500,000, a plastic extrusion machine. I can get white beads for less than a penny per pound or something like that. It's a simple raw material, and I can make all of my high volume suctions. Why would I do that? The cost of buying is so much less than the cost of making. I never would make those. Now, retainers, on the other hand, when I was using a line years ago, the cost per retainer that I calculated in my office was about $35 an aligner. And I was seeing very simply that with nothing, I could actually make them for $15, $16, $17, at the time, $13 an aligner, because some of the inflationary costs had gone up. So to me, it was well worth digging into what was happening. And so that is that make-buy decision. If I'm gonna make it, is it the same quality? Is the cost big enough for me to invest time in doing this? And so the answer is yes. So you're going to see that a lot with end users. So you need 2 things. Besides cost and time, now we're going to get down to the unit economics. Initial capital equipment and per piece costs. Initial capital equipment for direct print. We've got the printer, the wash, and the cure box. Now, at this point in the presentation, I always talk about the fact with LuxCreo it's simple because it's one integrated ecosystem, which is why when I was at the AAO that Mike was talking about, they had Graphy here, which had a big booth, everything, and you had LuxCreo here. I looked at Graphy, a friend of mine, Dr. Keeble and Kim at St. Louis, works with them. I was kind of leaning towards it because I wanted to get into this direct print methodology for many reasons. But when I went to LuxCreo, I realized, I'm like, wait a second. You've got the printer, you've got the wash, you've got the cure box, you have everything there that I need. And more importantly, if there's an issue, this is the part that got me. If there's an issue, you are going to understand the entire vertical on how to fix it. If I choose another company, they're using all kinds, imagine having a resin that can be used on 8 different printers, or however many printers that company can do. And if there's a problem, how in the world do you problem solve that? I don't know. I'm sure somebody can figure that out. Maybe they have, I don't know. But for me at that time, 18 months ago, I just realized, no, I kind of want to lean into a company where the entire vertical is controlled, because this is going to be a difference in the industry. And let's make sure we partner with a company that actually has it. So that's why I did that. Now, when I talk about other companies, like thermoform companies, I make a big deal about the fact that whatever printer you get, or more importantly, whatever resin you purchase, This is what I talk to orthodontists, groups, things that, whatever you purchase, you must use, I'm gonna say must, you must use the cure box that is recommended for that resin. Because if you don't, and something happens to the patient, I think that's a massive liability that you can avoid very easily by using the cure box. Now I say that because 9 years ago, when a few of us were really getting into full digital workflows and in-house aligners and things like that, people were using, I had a friend in Austin, on Amazon they sell these little dome shaped things that you put fingers in, like a nail spa. They were using that to cure their models. I'm like, I guess we're using what we want to use, but you try to save $3 grand on a cure box. And at that point, I kind of started realizing, like, no, I don't want that one patient that's highly sensitive to a micrometer of uncured resin and they have a mass dermatological reaction. I just would rather avoid that. Patients still might have that. I've never had one, but at least if somebody asks, I'm like, no, I used everything manufacturer the way it's supposed to be. So that was important to me. So initial capital equipment, so you're gonna see X's on some of these screens here. That X means I don't need that anymore. I don't need the thermoform machine anymore. That's not a massive expense, but you just don't need it. You don't have to have it if you're doing direct print in that respect. You know, you kind of barely need one of these, but it works out pretty well. Now this number, this was a number I had from when I made these slides. I don't know if that's the same number, updated number, but you know, they can help you with that. I haven't updated that in a bit, so.
Same.
It's the same? Okay, good, just making sure. Per piece cost. 5 years ago I made this, you don't have to memorize this, I promise. You don't have to look at this very much. It's just that was the flow chart that I used because I wanted to be able to change different levers in the equation to find out what my actual costs were. So this is a little bit older sheet that I just left on the slide, but you know, this essentially was the model that I used to be able to do that. So per piece cost. Now we're going down to, people were talking about the per piece cost, what do you need? I don't need this anymore. And when I was using this, you know, there's different resins here. I found that when you did a thermoform model, it would be 71 models. Now, the only way I did that was I used Sprint Ray at the time. They'd show me the model, they'd show me the number of milliliters. I added a 5% drip rate, you know, just the yield that happens when the resin gets washed off into the IPA, things of that nature. So that's how we calculated that. We knew over 10 liters of resin about how many models my practice yielded. Now, if you're in an area where people have large jaws, great. If you're a pediatric practice, you might be able to yield 90, you know, depending on the size of the jaws. If you print hollow, that's why as I'm going through these per piece second costs, when I look at it, everybody's might be a little bit different. But the goal was to help you understand these are some of the things that we measured. But in thermoform, you didn't need that. I don't need the package of thermoform. The resin tank is almost minuscule because of how infrequently I need to change it with LuxCreo. We get down here. Now, I did the same thing. I looked at 5 liters and how many I would get per. And so we ended up getting about 167, this says models, but really aligners. 167 aligners. Now, are those aligners, do they have the supports? Yes, like they have now. What's the thickness of those aligners? The thickness of those aligners is 0.7. If I was making 0.9, would I have the same yield right here? No, it'd be a little bit smaller. So once again, that's why understanding what to measure and how to measure gets you the actual cost of resin per tray, and then the tank cost. There's a little membrane there, but the fact that these last so well, and you know that I can change it every 20 liters, that's my cost, and then 167 trays per liter, we can easily put that in there and find the number. So when it comes to material costs, we have one last thing. You have to polish it. I mean, that really went down to nitty-gritty. I mean, I was looking at every consumable item that I thought would have any impact whatsoever. And so how many trays can I clean with this little bozo or Scotch-Brite here? How much does it cost me? Now, is the cost what the list price is? Or is the cost plus the shipping plus the tax? You gotta put all that in there. Well, you don't have to, but I just think for completeness sake, you probably should. If you're an end user and you really want to understand your economics on this, moving into that can help quite a bit. And then you have to package it. You can put it in a Ziploc bag for a penny, or you can put it in an actual baggie that has your name on it, things like that. So we choose to have one with our name, and you can write on the outside of it. So that's how much our unit cost is. So for all of everything we need to have, I need a DCA resin to make the aligner. I need the burrs and polishers, or really just the polishers, to knock the little nubs off. and then I need to package it. Subway. That was a weird transition. So, Subway. Now, something that comes up a lot. So, when I've spoken to people at different meetings, they're like, oh yeah, the material cost. So the cost per liner is $4.67. Oh, because you have to have a labor component. And we use Subway quite a bit, especially in business school. Love Subway because the ability to actually watch a product from inception to delivery is right there. I mean, you can sit there with a stopwatch and you can find out how efficient Subway is. It's absolutely fantastic. And looking at that in the orthodontic space, you know, we've got the bread, we've got the condiments, all those different things. When you make it a liner, it's kind of the same thing. You create it, you send it to the printer, you have your post-processing, you remove the spurs, and then you package. Now, these X's, as you can see, this is the time that you don't have to spend because you're not making thermoform models. Massive change in the labor force. With the thermoform, it would be 9 minutes and 20 seconds. So we save about almost 3 minutes per. Now, once again, it's not nitty-gritty, but if you're doing 30 or 40 a day, it matters. And we'll talk a little bit more about why it really matters in a moment. So, when I look at the total labor time and a calculated wage, if you're paying somebody $21 an hour, you gotta pay the payroll tax, add in some vacation and holiday, and if they have a safe harbor, big difference there. So knowing that labor cost, knowing how much it's gonna cost for somebody to do it is one thing. Now, the feedback that I typically get at this point is, well, I pay them anyway, what's the big deal? Let's go into that, let's talk about that. The software itself, that can be variable depending on, you know, if you use ULab, if you use Titan, if you use any other thing, I use ULab, so I know what the cost per STL to export is. So all of that taken into account, we have our labor service cost. We know what that is, 6 minutes divided into an hour multiplied by the actual cost of labor. Material cost, software, and then the yield. We didn't talk a lot about yield, but you're gonna have a failed print every now and then maybe. You're gonna have labor that messes up. You're gonna have somebody over polish it. I mean, many of you are in manufacturing, and to not calculate there's gonna be some sort of yield is a little naive in my opinion. So if you're doing in-house manufacturing, there's going to be some sort of yield that's applied. Today I'm not really digging into that much, but it ends up being about 8 cents per that we've seen over the time of having little issues here and there. Now, how can you eliminate yield? I am going to talk about it for a second. How in your business can you eliminate yield? If you're running a lab, training, proper steps, tight SOPs, that's how you reduce yield in anything. Essentially, it's like Six Sigma, when Motorola started that, with the black belt in Six Sigma, because they have 1 billion parts, and one change could mess up an entire production line. So that's where that really started from, was the Motorola manufacturing process in the original phones. But being able to control those items in your office can save quite a bit over time. So once again, that's the comparison that I've seen between thermoform costs per unit and direct print cost per unit. So if I'm able to save $3 each, that's pretty important to me. My recoup on the equipment, and the equipment itself. Now, I also have people ask questions about, well, you didn't take into account the equipment. Well, if I take into account the equipment, then I have to start adding in the models, the splints, the return on splints, the depreciation of the equipment, the useful life of the equipment. And so there's all these different pieces that make the equipment, and really, for accounting purposes, the equipment is a sunk cost. It's a capital equipment cost. I mean, so it kind of doesn't play. You bought it, so it can either cost you, if you make one aligner with the equipment, the aligner costs you about $20,512. So it just depends on how many you make. And so that's why I didn't, because that's going to be highly variable. An office that makes 10 a day versus a company that makes 2,000 a week. So that's one of the reasons why I didn't quite put that in there, because of the variance on that. Now, why did I put labor in there? Once again, I do get that question a lot. So let's go back to that question of labor itself, I'm paying it, it's a fixed cost. Why does it matter? Well, let's talk about why it matters. How many trays can your employee make in a week? Many of you know the answer to this. You probably do this at nauseam with your assistant with your digital text. And so, but a lot of orthodontists don't ever do this. We don't ever really look at this type of unit economics. So in this scenario, let's look at a 10-hour work, 10 hours. Now, 10 hours represents how much time the end user, like myself, the doctor, allows the assistant, not allows maybe, but assigns the assistant or lab tech to work on lab issues. And of that time, we all know that lab techs are not 100% effective. And what I mean by that is 100% of the time, they are not creating something. They have to make a phone call, they have to go to the bathroom, they're gonna talk, there's gonna be water cooler. And it's not that it's bad, that's just normal life. You're never gonna get, if you get 90% labor utilization, that's amazing. That 70% is probably a little optimistic. And I did this just for the math office. And we know it's about 6.69 minutes to create. So in that 10-hour work week, dedicated to lab, they may also be doing orthodontic assisting, they may be helping you in admin, whatever else they're doing in the orthodontic office, they can dedicate 10 hours a week to the lab. They can make, under these restrictions, 63 trades. That's it. Now, once again, well, they could make 65. Okay, well now, you've just changed this number to 10 hours and 12 minutes. And change it to 10 hours, 12 minutes, 10 hours, 30 minutes, 10 hours, 40 minutes, just to get a few more in here and there. Now you have a morale issue. You lied to me, you have overtime maybe. You've got, essentially all I'm defining is that you have a barrier to your labor that can actually create what's going on in your actual office. Because as an orthodontist, you've now become a manufacturer. And maybe we're not designed for that. Maybe we're not trained for that. Maybe we don't understand the restrictions on that. But this is a big restriction. And then, God forbid, every week you're doing, let's say you're doing 5 D-bonds and you need 2 retainers. So that same person making those aligners is also making those retainers for you. They just took away 10 of that. So now you've only got about 53 pieces that you can make a week. So once again, I know that's a lot of words, a lot of labor. I kind of went through it a little bit quicker because I feel like many of you probably deal with this already, so I didn't want to, try to talk down to it. But at the same time, the important piece I believe to understand is that as an orthodontist, if we're going to manufacture something in the office, the ability to find increased throughput, the ability to create increased production with the same amount of time is very important. I didn't put the number up here. When it comes to thermoform trays in our office at 9 minutes and 20 seconds, they could only make 44. So by using the system, I immediately increased our throughput using 10 hours as the piece of about 50%. That 43. Is massive, 43%. Thank you. And the ability to actually create. And so what does that save me? So if I'm using ULab, I'm spending $20 for a tray to be mailed to me in the USmile system. God, if you're using a line and you're spending $35, if you can make 20 more without overstressing your system, you just made a huge savings on that. And really kind of bringing it all the way back to why I even started doing this. I don't think I told that story. When Smile Direct Club started, when North Carolina's court case essentially shut down the whitening kiosk confusion, or I guess case that the Dental Association brought against it, that opened up the doors for direct-to-consumer dental to go nationwide, almost pretty much international at that point, or definitely nationwide. And I saw a problem. I saw cases that could be sold for $2,000, and my fee was $600 or $700, $800 for these light cases. Because back then, when it happened, Invisalign, a line tech, still had essentially a monopoly. Now, I'm not talking out of school. This is all very common information. This isn't judgment on it. It did a great job protecting your monopoly. And I needed a way to reduce that cost so I could compete in the new marketplace. Well, now we know they went out of business, they got greedy, did cases they shouldn't have done. Okay, once again, bring yourself back to that point in time. We didn't know that was going to happen. I knew there'd be a larger total addressable market. I knew that there was also a tidal wave of advertising that I thought I could benefit from. But if I had that huge 40% overhead per case, I just couldn't compete with that. And so that's why I originally got into the printing and making my own trays anyway 7-8 years ago. But the ability to increase that throughput using the LuxCreo system, I can't do that with anybody else. So here's some of the breakdown. you save about 21% when you're doing it. Our team saved about 2.89 minutes per tray. And the throughput went from 44, which was the thermoform that I told you about, up to 63 with 10 hours a week. Now, could I go in, could your office make a thermoform tray with 5 minutes of labor? Probably. If you do, call me. I'd love to hear how you did it. You know, we try to constantly, we use like a Kaizen theory. We're constantly trying to uncover what's slowing us down and move it out of the way. And so that's the piece that's where we are right now, that's savings. But we're constantly doing it. Now, I haven't redone those numbers using Fast Track. Now, using Fast Track, I probably did shave off another 30 seconds, 40 seconds. And that stuff does matter, because we're, like I said, I have a 1,400 square foot office. I start about 450, 470 patients a year. We really harp on efficiency. We have a very small nut to crack. I love that. Our burn rate is very low. Trying to stick with the tenets of it's not what you make, it's what you keep. And so that's the part that's really important to us as we do it. So my family, our son, he's a senior at Tulane, my beautiful wife, that, I still don't know how I did that. But thank you for your time. Do you have any questions at all?
Questions, anyone?
No questions?
How was the team designed?